COVID obviously has been a crisis, but let's not forget about the debt crisis it is facing the nation's major programs of Medicare, Medicaid, and Social Security. So Mike Reeves of Strategic Wealth Designers joining us now. First off, good morning to you, Mike.
Good morning, Scott. How are you?
I'm doing well. The debt, I don't think it's doing so well. When we're talking debt, we're not talking 6 zeros, 9 zeros, but 12 zeros. We're in the trillions of dollars and far into that. How bad is it?
You know, it's a major issue with Social Security. They have a trust fund that your payroll taxes go into, and then they pay out those benefits. Well, originally when they made that, you had 42 paying in for one person receiving a benefit. Now it's 1 to 3. And if you look at Social Security and some of their studies, they're saying that could run out 2036. The Wharton School of Business, based on the changes with COVID, less people working, they're talking about 2032. And when you look at Medicare and Medicaid, you're talking $50 trillion of unfunded liabilities. And that's actually the bigger issue, even though Social Security is it's talked about more often.
So that is the bigger issue, and a lot of people don't realize that. How do you think the next administration is going to have to deal with it, if at all? It seems to just get pushed to the next administration and the next one.
Yeah, but I think you're finally at a point where this regime's going to have to do something here. And with both programs, there are some options that have already been talked about. People that are receiving benefits already, they're likely to be grandfathered in. But with Social Security, there are things you could do. You could freeze the cost of living increase. You could raise the minimum age to receive that benefit. Those are a couple things. You could reduce the benefit, unfortunately, or eliminate it for the younger generation. With Medicare, what you could do here is more managed care. You're seeing that with those Medicare Advantage plans. And certainly you could also raise the age where you would start receiving a benefit. None of those are great options, but something's going to have to be done.
So during all this time, people are thinking about their money. They're waiting for the government to do something for them or to them. So what can you do in terms of building your investment portfolio?
Well, when you're building an investment portfolio, you should have already looked at Social Security as something that maybe in retirement you're getting 30 to 40% of your retirement income from that. If you haven't started that Social Security, now maybe you're dropping that to 20 to 30%. The younger generation, I just put a goose egg in that column. Very not likely to get any help. Now, fortunately, with retirement plans at work, the Secure Act, which was passed in 2019 towards the end of that year, they've added a provision that allows employers to add annuities or a way to have private pensions for employees so they can create their own guaranteed income. So that would be something that you could do. But regardless, you need to have a plan. You need to look at this ahead of time. If you're not comfortable doing it yourself, retain a financial advisor, make sure they're a fiduciary, make sure they specialize in retirement planning.
All right, for those who don't know, fiduciary basically means they are responsible for doing what is good for you, right, the investor?
Yeah, the fiduciary has got to act in your best ethical, legal, and moral best interest. It's a higher standard. They're regulated differently than that traditional suitability advisor that you might walk in and meet at a bank or a large brokerage firm.
All right, Mike Reeves of Strategic Wealth Designers. Mike, thanks for being here this morning. We appreciate it.